There's a photo here of Dr. Patterson. He's one of the surgeons that could have possibly done my surgery. He came and talked to me and explained some of the ways some of the details of the procedure, and was telling me, he said he's personally done over 500 surgeries since he began working here. Yeah, he was a really great guy, and I was really impressed by what he had to say. And so I ended up getting my surgery done by Dr. Brian Myers. He's another thoracic surgeon. But they were both really great. And I was thankful to have some of the best surgeons in the country available to do the procedures, and I definitely felt confident in their work and their abilities. This is another one of my hospital stays here at Barnes on the 13th floor. This was when I was admitted for a partially collapsed lung. They discovered it after I had a routine chest x-ray, and one of the procedures they were trying out is a non-rebreather mask. Is what that does, is it basically delivers 100% oxygen to my lungs, and it's supposed to reverse the lung collapse and allow my body to absorb some of the air that escaped out of the lungs into the chest cavity. When you're in and out of the hospital so much, you can't help but make friends and build relationships with some of the staff here. I know as a patient I was receiving 4 breathing treatments a day, and they have various RTs that come in, and usually they're the same ones. They come in every day, 4 times a day, and so I always have plenty of opportunity to talk and find out things about them and make conversation and stuff. One of my favorite RTs was Lamont. Friends and patients call him L.A., but he's a great guy. He would tell me about his coin collections, or he really liked old black and white movies, and he would get excited and tell me about some of the movies he was watching and things. But I've really been happy with all the hospital staff, and I've made several pretty good friends during my stay here. My younger brother Tim, he has cystic fibrosis as well. His condition isn't quite as bad, though. He's still a long ways away from needing a lung transplant, but he's recently switched his care to Barnes Jewish Hospital to treat his CF exacerbations, his infections and things with IV antibiotics. And he was fairly recently in the hospital the same time I was. But he's a character. He would joke around with some of the nurses and staff and things, and